Hi, my name is Allie. I'm one of the co-owners at Puget Sound Birth Center, and we're making this video to provide information for you, interested people, in learning about what we do here and what we have to offer, and hopefully helping you decide if this is a good fit for you for pregnancy care and your birth. Our birth center is licensed by the state. We're accredited by a national accreditation body. We employ licensed midwives who also have a license from the state. By coming here, you do not sacrifice access to anything. So all the testing, ultrasounds, procedures for your baby, you have access to all of that here. I'll map out a little bit about the structure of the care here. So we have 2 teams of midwives, and if you decided to work with us, you would be matched up with 2 midwives and rotate your visits so that you get to know them really well and they get to know you really well. And that's important because the whole foundation of our care here is about individualized care that is specific to your family, your health, and your needs. We call that the midwifery model of care. It kind of guides everything that we do, and included in that is the concept of us relaying information and helping you make choices. We call that shared decision making or informed consent. You'll always hear about things before they happen and know what your options are. We do a full range of care, so all the prenatal care, labor, delivery, postpartum, and newborn care, the same kind of care that your friends would be getting with obstetricians in a hospital setting. You can have anybody here that you want from your team. So a lot of our clients work with doulas. We often will have other family members, sometimes people's younger children in the room as well. On our team, what you're going to have is one of your midwives and then a birth assistant. Sometimes that person is a midwife also, sometimes they're a trained birth assistant. If a student has been involved in your care, then that person would be at your birth as well. So from our team, you're going to have 2 or 3 people. And then on your team, it depends on what your desires are. And we really consider everybody who's there is on the same team. Our entire focus is how do we safely get you and your baby through this process. Once your baby is out, on your chest, stable, you both are stable, there's things that have to happen before we can let you go home. Generally, people stay around 4 hours postpartum, which I know sounds quick compared to the cultural expectation of being in a hospital all day. But the truth is, if you and your baby are stable and well, then you're safe to go home. We midwives are accessible 24/7. So if you get home, you have a question or a concern, you just page, we call you immediately back, and we talk through things. Because we have a shorter stay here and you go home sooner, we come to your house between 24 and 48 hours and provide a lot of the things that are typically offered in the hospital for you and your baby before you leave. We just do those things at your house. And then we see you every couple of weeks until about 6 to 8 weeks. And the truth is we custom make our care, kind of like everything in midwifery is custom made for each client because everyone has different needs, right? So if we have a first-time mom who's having a lot of breastfeeding issues, we're gonna see that person way more frequently. And if you're one of those moms who has 8 kids and coming in for a visit is more stressful than skipping a visit, then that works for us too. We can do phone check-ins, we can do messages through the portal. Basically, we'll do whatever is needed to make sure you and your baby are doing well. We do all our visits in the birth center suites so that you get a chance to feel really comfortable with your environment, and you've got lots of time with the midwives to get to know them and for them to get to know you. There's been tons of research done about physiologic natural childbirth and the key things that help people through that. One of them is comfort in your environment, being surrounded by people that you trust and feel safe with, and being in a room full of people that believe that you can do this and support you in doing this. So that's sort of the foundation for the midwifery model of care that we offer to our clients. We take care of low-risk pregnant people. And that's pretty straightforward. Like, you have to have only 1 baby in there. At the time of labor, your baby has to be head down. Don't worry about that because we'll do a ton of things to make that happen if it's not the case at the time. We can't take care of people that have had C-sections before. You have a 5-week window in which to have a baby here. So you have a due date. 3 weeks before your due date to 2 weeks after your due date is considered full term. Part of prenatal care is to make sure that you wait until that 37-week point to go into labor. Largely, we're screening for preterm labor and helping you avoid that. So it doesn't come up very often where people aren't in that window, but that is also one of the things that determines low risk. All the time I hear people, but I'm over 40, can I still have a baby with you? And the answer is yes. Being in your late 30s, in your 40s, does not disqualify you from our care. We take care of people that are considered advanced maternal age. I don't like that statement, but people that are older all the time can have safe pregnancies, healthy babies. Another thing that I get asked is, I'm a woman of size. Can I still be in the birth center if I'm considered advanced, higher BMI? And the answer to that is yes also. We take care of people of every size. We have healthy pregnancies in our mamas of all sizes. Can I take care of you if you get gestational diabetes? The answer is yes. Most of the time, diabetes is easily controlled with diet and exercise. Sometimes needs oral medication. We can still take care of you. The only time we have to send people into hospital care is if they need insulin to control diabetes. Let's sketch out for you what normal care looks like. We do all the prenatal care that you will need as a normal low-risk pregnant person. So we'll see you every 4 weeks at the beginning of pregnancy until you get to about 28 weeks. Then we start seeing you every 2 weeks. Then as we get closer to the birth, we start seeing you every week until your baby comes out. In the very last week, if you make it past 41 weeks, we see you every few days just to keep checking in on you and the baby and make sure that it's fine to continue waiting until you naturally go into labor. We're in network with most insurance companies, and we do take Medicaid. Our billing is very similar to hospital-type billing. The facility will bill your insurance company. The midwives will bill your insurance company for the professional fees. Every plan is different, so I really encourage people to talk to our billing service, and they're wonderful at answering all the questions. And you will get, at the very beginning of your care, an explanation of all those benefits and what you can anticipate having to pay out of pocket based on your specific insurance. We provide humane, respectful care to all of our clients. For low-risk, normal pregnant people and normal babies, this care is as safe, if not safer, than being in a hospital. So what's really important to us is to be able to have conversation and talk about these different things, all the testing during pregnancy, all the procedures for your baby, and then that you ultimately feel like you have what you need to make a decision. Our midwives are really good at their jobs. We know how to get babies out. Our C-section rate is less than 6%, which in the national picture right now is astounding compared to the 30+% that we see at our local hospitals. So if you want natural childbirth, this is the place to come for it because it's all that we do. When you see the birth center, it will be very obvious how different it is to be laboring here than in a hospital. So we have a queen size bed so that you and your partner and your baby all fit on it. Beautiful birth tubs, which you'll get to see. We encourage people to labor in the tub as you feel comfortable. About half of our babies are actually born in the water. The other half of the babies end up being oftentimes on a birth stool. We have this little low, it's kind of like a toilet without a front. So you're able to sit on it and be in a kind of squatting position, but without having to hold yourself up. And then the midwife can be right in front of you and catch your baby in that position. Oftentimes we'll have your partner behind you so that you have somebody to lean into. And then a small fraction of our babies are born on the bed, but quite honestly, not very many. And the truth is that we just follow you around in labor, and our goal is that you're comfortable and we support you in whatever position that is. So I often say, I would rather get in a very strange position on the floor to catch your baby than have you in a really uncomfortable position on your back with your knees a certain way. So that's kind of how we roll in midwifery care in general, like custom made to what is comfortable for you. And in our closet, we have all the things that we would need to control, as an example, postpartum hemorrhage. If there's bleeding with your placenta beyond what's normal, we have 4 different medications to help control that. We have IV fluids if you lose a little bit too much blood, but we've stabilized it and everything is okay to stay here. We can do an IV and add some more fluids to make a person feel better. We have a medication to deal with seizure and shock. Both of those things we're using before they happen as a means to stabilize a person so that we can get to a hospital if we need to. Those are not things that we use on a regular basis. Another benefit of midwifery care in this context is that we're not just taking your blood pressure, measuring your belly, and listening to your baby's heartbeat. We're getting to know you. We're talking about all of it. We're talking about your family if you want to. We're talking about your fears and your excitements and helping you prepare for what's coming. We incorporate nutrition, exercise, lifestyle, all the other ways that you can support the health of you and your growing baby. The midwives want you to bring your questions, your concerns, your fears, your excitements into your visits. That's why we're here. Yes, we're here to safeguard the safety of you and your pregnancy, but we're also here as a resource and to build relationship and camaraderie so that you feel safe in your care and in your birth. People will say to me that they learned so much in this process of midwifery care that their parenting in the medical establishment was different and changed after that point. They understood more what questions to ask, how to think about testing, how to think about procedures for their family, and it helped them learn how to advocate more in the medical establishment. So I see that also as a really important aspect of what we do with our clients. We have a lot of ways to support you through the intensity of labor. In addition to all the comfort measures that we use to help you through labor, we also have nitrous oxide. We encourage the use of doulas. We have the tub. We keep you hydrated and fed and moving around. We have birth balls, and we have our hands for massaging and rubbing and our voices for encouraging. And basically, we do whatever it takes to help you through it. When a baby's born, in the water, not in the water, they immediately hit the air, triggers them to breathe, and we put babies on your chest to make that transition. Babies that come out vigorous, turn pink quickly, literally the only thing we're doing for that baby is making sure that it's covered with a warm blanket so that it doesn't get cold. But we are very hands-off with newborns unless they need help. And a baby that needs help is very obvious, and we are very quick to respond. We have equipment for getting oxygen into a baby, establishing an airway if we need to, either just what we call kind of jump starting the baby is usually all it takes. Do a few breaths for a baby and then they start crying. But if the baby needs more than that, we have oxygen, we have what we need as the medics are coming to help with that baby. So let's talk about what happens when we need something that we don't have access to here. Most of the time when we have to go to the hospital, it is for completely low risk normal reasons. Baby is stable and healthy, mom is stable and healthy. We've just reached a point in the labor where we can't make more progress. We've tried everything in our bag of tricks. We have a very large bag of tricks. And we realize we need to go in usually for the things that you came here to avoid, which is the epidural and Pitocin. So a tired uterus doesn't get a baby out well. And sometimes if you just get dealt a crummy labor where the baby is in there cockeyed or has their hands up or something that makes it not fit as well, it can take a really long time. So exhaustion is the bottom line for the reason that we go to the hospital most of the time. We have a 14% transfer rate. And of that 14%, only a tiny bit of them are urgent transfers. So urgent transfers are things that we can't put you in a car for. So if a mom has lost more blood than her body is comfortable with, we have 4 medications to control that. We have IV fluids, but sometimes people will need more care for a longer period of time at the hospital. And we're never going to put a mom who's lost a lot of blood into a car. So that would be an example of why we would call 911 and have the medics take you to the hospital. Our midwives are well trained in how to handle emergencies and urgent situations. We have all the equipment we need. We have the emergency medications. We offer you every test that's out there with no assumption that you're going to do them, but with the assumption that you want to know what your options are. If, based on that testing or our normal prenatal care, something starts to deviate from normal, your blood pressure starts to go up, you test positive for gestational diabetes, These are things that we know how to manage and handle, but we do that with the help of one of the consulting doctors in the community. So generally speaking, for a normal pregnancy, you won't ever have to see a doctor, but sometimes it does come up where we need to consult with a doctor and have you do an office visit or an ultrasound specific to a reason. And then we've worked very hard with the high-risk OBs over at Evergreen and in Bellevue in Seattle. There's many locations we can send you to that we have great relationships with, that we can call and say, hey, we need your input on this, send you over, you get some more information, we get some more information, and then we can make a decision about how to move forward. We really, as midwives, have a lot of fun doing our job. It's wonderful getting to know people. It feels like soul work for us to support your growing family and help you in this process and guide you through this process. My goal is that when you come to visits, you leave more at ease, more at peace, with all of your questions answered, and knowing how you want to continue until your next visit. If you would like more information, there's tons on our website. You can email or call the front desk. They'll hook you up with an initial visit or answer any other questions that you might have. Check out Google. We have a ton of 5-star Google reviews, and honestly, it's really fun to read them and see how happy people are with this kind of care, because I really believe in this kind of care.